We've often heard that an aspirin a day can prevent cardiovascular disease, but there's new guidance that may contradict that.
In Eye on Health, Latrice Curry sought the advice of a local cardiologist. He explains you may want to throw them away or others should keep them.
For years, doctors have recommended people in their 50s and 60s start taking low-dose aspirin every day to protect against heart attacks and stroke. Not anymore.
It's really been a huge area of debate. Even if you would have asked me 5 years ago, I would have told you I thought we should have put aspirin in the drinking water.
Now there is new guidance from the U.S. Preventive Service Task Force, who recommend against it for primary prevention of heart disease for patients over 60.
So there's a calculator we use called the ASCVD calculator. And what that does is that plugs in a whole bunch of things about a particular person, whether they have blood pressure problems, whether they have high cholesterol, whether they're male or female, what their age is.
Dr. Wienen says if they have a greater than 10% risk of heart disease in the next 10 years, then it may be a good idea to take a daily low-dose aspirin.
But if you are less than that 10% risk, then maybe that's not going to help prevent the heart disease that we thought it was.
The new guidance says that the benefits do not outweigh the dangers when it comes to the risk of bleeding.
Because we know aspirin isn't benign and that people can have especially gastrointestinal stomach ulcers and bleeding and those kinds of things. So we really want to be weary of doing that for just anybody, especially people who are at higher risk for having bleeding complications.
Doctors say the risk of bleeding goes for those patients 60 and older.
And then people who are on aspirin, even if it is for primary prevention, they're saying probably come off of it by age 75 because that's really where the risk of bleeding goes up.
Thanks to Latrice Curry for that story. Be sure to talk to your doctor before you start or stop any aspirin regimen.